Stariera Becco, and I'm a research assistant working under Dr. Gloria Lee, who is also here with us today. And she's part of the Department of Counseling, School, and Educational Psychology, and today is July 13th. I will tell you guys a little bit about what is autism. Sorry. The title of my research is Parents of Children with High Functioning Autism and How Well Do They Cope and Adjust. I will tell you guys a little bit about what is autism, some of the treatment that can be be curable from them, background information, our research questions, a little bit of the methods, and the results, discussion, my references, and acknowledgments. So, what is autism? Autism can be classified as pervasive developmental disorders, which is a little bit of low functioning autism, high functioning autism, and Asperger's syndrome. Low functioning autism will be like the more severe autism, which can be like lack of speech or literally like mute, whether it's because of like high functioning, which is more of like talking, but it's also like a milder form of it, and Asperger's syndrome can be classified as like basically the same thing as autism, but with a little bit of symptoms, meaning that the child will be diagnosed with it like later on, probably like 5 years old, depending on like how like severe they are, how low they are, and autism can be classified as early as birth to like 3 months, and it goes on to 3 years. Some of the diagnostic criteria includes, like I said before, lack or delayed language, failure to form peer relationships, and repetitive behaviors. Autism can also result in some of the comorbidities, I think I said it correctly, and which can be like depression or anxiety or OCD, and also ADHD. Treatment can include therapy, which can be individual therapy, language therapy with like a speech pathologist or just like a psychologist or a psychiatrist, and family therapy, so like for their parents or their main caregiver to like learn to cope with like the child's autistic disorder. Also like medication or alternative treatments. Some past research found that raising an autistic child can highly increase like stress levels on like the specific parents, which may be like the mother or the father. Also, life functioning can be also affected because of like the child being autistic is like a slower pace of like having social interactions with people, or just by being independent by themselves, or having like disabilities and like functioning and like academics. Mothers and fathers have different coping strategies and obtain social support, meaning that a mother will probably be more depressed than like the father, and like more dramatic, because mothers is like, oh, that's like my baby or whatever, but then fathers is more like calm down, get to this point, get to that point. They're not as depressed. So like our study, we focused on like the investigation of parents' coping skills using a variety of variables. We feel that parents of autistic children will report more like higher levels of depression and anxiety versus parents of non-autistic children, and mothers specifically in a high-functioning autistic group will report higher depression, but with the lower scores in motor adjustment. Also, mothers and fathers in a high-functioning autistic group will report different coping strategies. We used 48 parents in the high-functioning autistic group, and the non-function autistic group was 26 parents, and this was not randomized. It was basically the parents that felt that they wanted to be a part of the study. They came and participated. That's why like the numbers is not the same. And we used like 6 different surveys, one which measured like anxiety, depression, and marital adjustment, and like a demographic form to like give us a little bit of insight of like the race of like the parent, how much money they have, or like where they was brought up, or like similar things like that. And also we used 2 coping measures. One, as you can see, was family coping, and the other one was coping with the health disorder, meaning the autistic child. To measure these results, we use T-statistics, which is basically a comparison of two different scores, you can say, and also p-values, which is like the probability of like our results being like significant. So as you can see, for the high functioning autistic group, mothers in fact did report higher depression levels than a non-autistic group, and fathers also reported higher depression levels than fathers in a non-autistic group. Also, for the marital adjustment, the non-autistic group parents reported higher scores, meaning that they were comfortable with their living condition and how they worked together with their child. But the high-functioning autistic group had like slightly lower, which also meant like there was a significant increase. For the coping we use like CHIP, which were 3 subscales, and for FCOPE we use 5 subscales. For subscale 1, the family optimism, there was a significant effect, meaning that the high-functioning autistic group coped less with like the parents coped less with like the autistic child, and the non-autistic group, they had like a better coping strategy because the child didn't have like any disabilities. But the main point that we wanted to show was that for FCOPE, subscale 1 and subscale 2 in fact showed the difference between autistic children and non-autistic children parents. And the most significant one was in subscale 4, which was accepting help. And between like the mothers and the fathers, we focused on basically the high-functioning autistic group. And they also showed a significance because fathers tend to like cope less with the autistic child, whereas the mother reported like higher scores. For the discussion, we came to a conclusion that parents of children with high-functioning autism in fact do report higher stress levels with depression and anxiety compared to parents of children without disabilities. And for marital adjustment, they also reported lower scores. Also, for the coping of high-functioning autism parents, for, like I said before, subscale 1 and CHIP was the difference, where significantly higher significance was in FCOPE, subscales 1 and 2, but a better significance was in subscale 4 with accepting help. And here are some of my references that I used from like previous literature. And I would like to thank Dr. Gloria Lee, who was my mentor, and Shanna Crump-Owens from CSTEP and the CSTEP staff and interns. And I would especially like to thank Tawana, no offense, Matt, because she hooked me up, well, I shouldn't say hooked me up, but she introduced me to Dr. Gloria Lee, and I will be working with her in the fall on to the spring until graduation. And that's it.
Tell me, you said that the participants weren't randomly selected. Can you tell us a little bit more about how participants came to participate in the study?
Okay. With the participants, they were basically spoken about like on interviews. They would hand them like information saying what we're looking for and how we would like to like get the information. So it was basically like the parents either accepting the application, which was like a packet of like the 6 surveys that I mentioned, and if they accepted, they fill it out, but if some of them, they also denied it, they will either return the envelopes back without anything written on it, or they wouldn't return them back. But if they did, we have like an interview with them, speak with them, have them fill out the surveys, and like we go from there. And the same thing went for like the parents without children with disabilities. They decided to participate in the study just because maybe they wanted to actually see the difference between not having a child with autism versus having a child with autism. Like how well do they cope, whether their stress levels is high or low, and whether like anxiety is like in fact.
I know in your results you found that parents who sought help, sought support services, had greater satisfaction in terms of marital satisfaction, and that that they were able to cope with their children's illness a little bit better than the parents who didn't receive support services. Was there any correlation with income, with parents' proneness or likelihood to getting help? Did you find that low-income parents sought out help more than parents who had higher incomes, or did parents with higher incomes have financial resources to get other types of support services to help them deal with their children's illness?
Okay, that's actually a good question. Because like the parents that we had, we did have like an income scale, and I believe the highest income was like 70,000. But that was something that was not really like a variable that was studied, whether it was like higher income the more help you get, or the lower income the more help you get. So like that would be something to look into.
You said you can classify autism at birth.
Huh?
You said you can classify autism at birth.
Did I say that? I think if I said that, then to distinguish the fact is, I was trying to say that when a child comes out, they do their little babbling and stuff like that, and then up to like 1 or 2, that's when you really know, or probably like 8 months, when a child starts actually not speaking, but like they're grasping words and they know how to like reach for this and reach for that. So between 1 and 2, if your child is not like not speaking or not attempting to speak, as of 3 years old, you can go and have them like diagnosed for autism.
How effective are the therapy? Like, can they live a normal life after, like?
I would say yes, because recently I have been introduced to somebody who is actually autistic, and she's doing fine. It just depends on how severe like the patient is. So like some can talk and some might can't talk, but like if you have like one-on-one sessions, the therapy is based on like getting like that child to like break out of like the repetitive behaviors and like actually realize that there's somebody else in the room, and they need to like try to like form a relationship with them and try to like get them out of their state of being like shy or not speaking to somebody. So eventually, it's not, if you was born with autism, it's not saying your life is ruined. There's always ways to like help, and like you could actually be like some of like famous people today. They have autism and they broke away from it. So it's not like you're stuck and like this, and the world's gonna shut down. You can like always get like a PhD and be good in life.
When the child comes for assessment, like if they are experiencing some of those symptoms like lack of social skills, nonverbal behaviors, lack of social skills, what assessments or what tests do you use primarily to help determine whether it's autism, Asperger's, or whether it's just the child's just not ready or shy?
That's another good question. I would assume that the actual test itself would have to be like ran over and over, because as autism is something that can be compared to like other disorders such as mental retardation, and they're so similar that it's like hard to like distinguish whether the child can't speak or whether the child just don't want to speak to that person. So it's like I wouldn't know the exact specific like scale that it is. But I'll look for you.